thank you everyone for joining. Now I'd just like to turn this over to Laura, Laura Keivel is the Manager of Grassroots Advocacy at the Arthritis Foundation, and she's going to speak to us about their recent experience collecting patient stories.
Great, thank you for the welcome, and I'm excited to be here. And again, I'm Laura Keivel, and I'm the Manager of Grassroots Advocacy with the Arthritis Foundation. And I've been with the foundation for about 2 years now. I started off as Coordinator of Advocacy Operations, and from that role, I coordinated our annual Advocacy Summit, and now in my new role, I'll be working exclusively with our Ambassador Program, and I'll get into what that is in a couple of minutes. But the Arthritis Foundation is a great place, and we do a lot with our patients and try to get them access to medications and other issues related to that. And I'll go into exactly what arthritis is. There's a lot of misconceptions about the disease. So with that, I'll get started. So just a quick overview of the Arthritis Foundation. We're the largest nonprofit contributor to arthritis research in the world, and we get most of our donations go to funding research, and any grants that we get, it goes to funding research to cure arthritis and to fund therapies for arthritis that would help with rheumatic diseases and other kind of diseases like that. So we're also the largest national nonprofit organization that supports more than 100 types of arthritis and related conditions. So what that means as far as related conditions is that it could be lupus, it could be psoriatic arthritis. I do believe psoriasis might fall under that category as well. There's, of course, rheumatoid arthritis, juvenile arthritis, osteoarthritis, which is pretty much the form that you're most familiar with. You know, a lot of people think when they think of arthritis, they think of an older person getting, you know, the creaky bones, but that's basically what osteoarthritis is. If you're an athlete and you wear down your joints, that's also what osteoarthritis is in most cases. So it is one of the more common forms of arthritis, and definitely the one we're all used to. We're building a state advocacy program, which is new for us. We've mostly focused on federal advocacy, but now we're going to be going into the states and working on access to issues there, biosimilars legislation, step therapy legislation. So it's a very exciting time for us as we move into that, and we're also still focusing on our federal legislation. Some of you may know we support the Patients Access to Treatments Act, H.R. 460, and we're active with that. We also have a Congressional Arthritis Caucus that we're planning more events with, and we're reaching out to them for more support. So we definitely have a strong caucus that we're building, and we'll continue to build once the elections are over this year. So there you see in our photos, we have some of our advocates, and we took those pictures during August recess. We had our ambassadors go out into the field and meet with their member of Congress. So in the right-hand corner, you'll see one of our Tennessee advocates meeting with his member of Congress, and his daughter there has juvenile arthritis. And then we have over here on the left, she's meeting with her congresswoman and forming good connections with her there. Any questions about the Arthritis Foundation and what we do so far? Great. So about arthritis. Again, there are many misconceptions about arthritis, and it's one of the more common chronic diseases. Arthritis is not curable. Once you get arthritis in any form, it's not curable. Osteoarthritis, of course, is not curable. I mean, a lot of people have their joints replaced or their knee replaced, their hip replaced, and that's basically a way to manage it, but it's not curable. And 50 million Americans have this disease, and it's more than diabetes, it's more than I don't think it's as much as heart disease, but it's one of the top ones, and it's also a comorbidity. So if you have heart disease or diabetes, you're more likely to have arthritis. And 300,000 children have arthritis. And every year we have a JA conference, which I'll also go more into as we go on, that brings a lot of these kids together, and they form a really great community of kids to have it, because it's not as common, and a lot of people think that arthritis is for older people. So when a kid says that they have arthritis, a lot of people, and their teachers especially, don't really understand what that means. So we have an education program, health providers and teachers on what arthritis is for children and how best to treat it and how to manage the disease. And also, of course, arthritis has over 100 forms, and some of which can be fatal, and it can cause blindness. And I'll talk about one of our advocates who went blind from arthritis. It's called uveitis. And arthritis is the leading cause of disability. So that means that it could be anything from having rheumatoid arthritis and losing your ability to walk, or having osteoarthritis and having both of your knees go out and having to be confined to a wheelchair and not being able to walk properly, or being temporarily disabled, which I'm quite familiar with. We have a lot of our advocates that have surgery and they can't work, and they do advocacy work to make them feel like they're contributing, and it's wonderful that they are able to help out that way and share their story. Any questions about arthritis and the condition? All right, so about the Arthritis Foundation Grassroots Program. We have about 65,000 e-advocates and about 750 ambassadors. Our e-advocates are basically our boots on the ground. They're more of a one-way communication. We send letters, we send them action alerts if there's important legislation coming from state or in Congress. And so they don't necessarily build relationships for members of Congress. But the ambassadors do build relationships, and their main goal is to form a relationship with the health legislative assistant or with a member of Congress, and we train them every other month. We have speakers that come on the call, and we also have an assignment that we give them that relates to on policy-wise. So we have, during August recess, we have our ambassadors go out into the field and meet LA or a member of Congress. We have them submit op-eds to their local paper about arthritis issues. We also have them meet with candidates during election season, which they're doing to talk about these issues as it relates and what those candidates should look for if they're eventually elected, and know how serious the arthritis issue is. And we also do trainings across the country. We'll fly to some of our regions and do some trainings, and we'll also have other conference calls to discuss tactics and ways to be effective advocates. So you'll see at the bottom again, we have more of our advocates meeting during our Advocacy Summit and during August recess. So very exciting program, and we're again looking to expand that into the states, and we think that we can affect change by working at the state level, and we're going to start training our advocates and having a tracking system of how they can track legislation that's going through that would affect them. So as part of our grassroots program, we're always looking for different ways to be effective and tell our story, since arthritis is so misunderstood. So before the RJA conference, which happened over the 4th of July weekend this year, my coworkers and I were discussing what we could do while at the JA conference, our Juvenile Arthritis Conference, that we could harness the power of advocacy. And we came up with the idea of filming videos and saving those videos and sending them to members of Congress to show them if, there's an important vote coming up, we could just fire off a video to the member of Congress and say, here's your constituent, and this is their story, and this is why you should care about arthritis. Moving on to our next slide, again, why arthritis is misunderstood. A lot of people don't know that kids can get arthritis, and it's, again, thought of as an old person's disease. And even then, while we are working on this with members of Congress, we'll have advocates come in that are younger, like in their 20s and 30s with arthritis, and they'll look perfectly healthy, but they'll be in a great deal of pain or have a flare-up. So that's something that a lot of people don't understand, is that though someone could look healthy, they're not necessarily feeling their best. And we wanted to convey that to the member of Congress, that this is something that they deal with every day and that it affects their work. Some of them can't lift a baby, they can't walk, they can't get themselves out of bed, they can't shower. So think about that if you had to deal with that on a daily basis and the challenges that you would face with this terrible disease. So we needed to find a way to quickly and, I guess, emotionally convey these stories to members of Congress. And again, they're easy to send to lawmakers. We could just stick it in an email and send it over, or put it in a DVD and send it over to them that way. So I have a couple videos that I have links to in the presentation, and I really would like all of you to check them out. They're quite powerful. And we don't just have 3 of them on our website. We have many, many more if you're interested in the stories. They're incredibly compelling, and honestly, while we were filming them, some of them, there was not a dry eye in the room. It was an amazing thing. So with the first video, we have Anna Grace here from Jonesboro, and she was diagnosed at age 3 with juvenile rheumatoid arthritis. And I do believe she's 13 now, and she can't do simple things like do cheerleading. She would love to be a cheerleader, but she simply can't be on the team. She can't dance. She can't, if there's a school dance, she can't dance the entire time. She gets really tired, and she's in constant pain. And she was often bullied because the cost of the medications are, and her mother had breast cancer. They weren't able to afford, the cool kids' clothes. So she was bullied and is still bullied because of arthritis and because of the impacts it had on her family. So she, again, lives in pain every day, and she's, she's in middle school, about to go into high school, and just think of how much of a difficult that time was for everyone, and to have this chronic disease on top of that is a pretty heavy thing to have. So our next video is Chris Anderson. He's from Iowa, and his daughter Nicole is 12 years old. He's also an arthritis ambassador. And Nicole she was diagnosed at 3 years old, and she's already had both of her hips replaced, and she's only 12. So Nicole will eventually have to have another double hip replacement as she grows up. And you'll see in the video, if you watch it, Chris carries around a model of what a hip replacement looks like. And he says that it's a fun time going through the airport security with that thing in his bag. But he likes to show that when he goes to meet with his member of Congress or other legislators, and even just, talking to people about the condition and why his daughter can't walk and things like that. So it's really been powerful to bring that to her school if the teachers are having a hard time of why she's not participating in gym class or running around at recess. So you'll see here in the first picture on the left that Chris is administering a shot to her. He has to give her a shot every week, and it's not a pleasant shot at all. It really helps her walk. I forget exactly what the medication is. And in the middle, it's her right after her hip replacement. And when I first saw that picture, I thought that's, she's too young to be with a walker and in a hospital looking like that. And then you'll see her on the couch there, and I do believe she had her knees replaced, or she was going through a flare there. So she's had several joint replacements, and she's not even a teenager yet. So because, it's a pretty powerful story, and not a lot of people can see these images, so we had Chris at our JA conference film a video to talk about his daughter's struggles and why they should care and what they can do to help out Nicole and her family. Then finally, we have Joy Ross from Portland, Oregon. She was diagnosed with juvenile rheumatoid arthritis and uveitis at age 3. And uveitis, it's a type of arthritis that affects your eyes. And she started having eyesight problems when she was a teenager, and it continued through college. And then eventually, I think it was in 2007 or 2008, she eventually lost her entire eyesight. She can't see anything at all. And she actually has glass eyes. So you'll see in the video she talks about her eyesight and all of that. And her eyes are completely shrunk. So since your eyes are a muscle, and if you don't use them, you lose them, so she lost all of her eyes, and they're very small in the back of her head. So as a result, she started a support group and was actually featured in Real Simple magazine earlier this year in the spring. and she runs a support group and has a guide dog that she also uses to help her get around, and she also meets with other blind patients that have seeing eye dogs. So it's incredibly, she's very incredible that she can get around, and she's also raising 2 kids, and one of her children has rheumatoid arthritis, and then the other child has rheumatoid arthritis and uveitis. And you'll see in the video that Joy talks about the struggles that her daughter has after her daughter saw her go blind, and she's expressing her concern that she'll go blind, and it's incredibly heartbreaking. This one is the one where you should have a box of tissues around. It's a lot to handle, but Joy is incredible, and she's one of our most powerful spokespeople.
Arthritis is genetic?
It can be genetic. When Joy was going to have children, they said that it would be a very small chance that she would pass the gene on, but she ended up passing it on to both of her kids.
And she speaks about that in the video, and I think
yeah.
that's probably the most powerful part of the video. If you have a chance to watch it, it's just her talking about how her daughter is going to experience the same problems, and her daughter basically asked her if she would go blind, like her mom. So it's just a really powerful video, and
yeah, you'll definitely have to bring out the tissue.
Yeah.
What was I going to say? Yeah, when we were filming the video, it was me, my colleague, and Joy's husband, and all of us were in tears. It was something else. So yeah, we did this at the JA conference, but we are planning to do this at our Advocacy Summit, and it's very great to do around a big event. But we did it on an iPhone. We did all of them on. You could go right now and make a video and use that. So we're encouraging our advocates to make their own videos and send them to us. And we're trying to figure out how to make a good bank that we can use and have the space to store it. We found that they're quite big files. But yeah, all you need is an iPhone. We had a tripod that held the iPhone, and we just had some basic editing software to contract it out to anyone. We had the software in-house, and we just had to find a quiet space at this conference to film all of the videos. We had a black background, and we actually had it in a corner of a hallway, so it looked a little strange, like, hey, come film a video, and we just have this curtain up. It was very weird, but it worked really well. We had a lot of people that were interested in doing it. We got about 60, 70 videos from the whole event over the course of 2 days. So we also found out where they were from and got their address and information so we could figure out where they were from, and we have them sorted by congressional district so we can send them out whenever we need to. And also to get the taglines, I guess, that we wanted, we didn't want to script them. That was a pretty important thing to us, to not script them, since their story is their own story and there's no accurate way for us to really take that over. So we had a series of questions, which was, especially for the little kids, the adults didn't really need it. They already knew what they were going to say and had their, I guess, elevator speech down about arthritis and their story down pretty well. But it was like, how does arthritis make you feel? And the little kids would just say that it made them feel bad every day, and they had to have ice packs, and it was also very heartbreaking. And also the big one was, what can't you do because of arthritis? And again, with Anna, or I think it was Anna Grace, she couldn't do cheerleading. She had to miss out on going to a lot of activities with her friends because she was tired, and it's more of what, how arthritis affects your life rather than anything else. Because it's all well and good that they support the legislation, but if you don't know why they do, then it doesn't really get your point across. So you'll see here in the slide, we have the booth that we set up, and we would just advertise at the booth that we were doing the videos, and we would send them on over. And also the little blurb we have here about how I feel about having arthritis. This was part of one of our breakout sessions at the JA conference, and we had a lot of parents that are JA's parents volunteer to work this session, and they had these little bites that we've been using in some of our publications and other things that we have sent to the Hill. Any questions about how to create the videos?
What software did you use?
That's a good question. I'll have to ask. I think it was just some sort of picture editor. I think
Okay.
it might have been on an Apple computer,
Okay.
just the basic one that comes with it. Yep. Any other questions?
How did you come up with the idea for these videos?
So we were thinking we always send letters or postcards to our members of Congress or have them send it to their members of Congress. And we wanted to do something different that really gets the story across because if you see the blurb here, it doesn't really tell their entire story. So we wanted to put a face and a name to the condition and to show them that that there are real people affected by this disease and that it could be your neighbor, it could be your sister, your best friend, to make it more personal.
How do you share them with Congress?
We just put them in a file and we send it by email, or we put it in a DVD and give it to them while we're at a meeting.
While you're using social media, are you using any kind of hashtag?
We do have a hashtag. It's face arthritis. Hashtag face arthritis. That might change, but we use that for our Advocacy Summit, and we also use that at our JA conference. But these are all on our YouTube channel, and I do believe some of them are up on our Facebook page.
It might be a little too early to ask this question, but do you find more videos are coming up?
Like that we'll make, or
do you find that people are making videos with the hashtag face arthritis after posting these?
Not as much. We haven't really made a push for it just because we're getting our footing on what exactly we want to do with them. So once we have a strategic plan on how to use the videos, we're definitely going to reach out to our grassroots and tell them that we're making a push for this. And I think we're especially going to do that around our state legislation once we get a clearer picture on what the states are going to be doing next year, and also provide them with talking points and, again, questions to prompt them to share their story.